discussion is how to deal with emotional trauma. And for our discussion, we have with us Dr. Namita Singh, consultant psychologist at Apollo Hospital, Jubilee Hills, Hyderabad. Dr. Namita Singh is a registered rehabilitation psychologist under the Rehabilitation Council of India. Dr. Namita Singh has her PhD with a specialization in neuropsychology. She has more than 20 years of clinical and academic work experience in different establishments. She has been fortunate of having work experience at the Defense Institute of Psychological Research, one of the premium labs of DRDO, the Army Hospital Delhi Can, and the Psychiatry Department in the Government Medical College and Hospital Chandigarh. She is also consultant and faculty member in the premier universities in India and South Africa. Welcome doctor to our Facebook live session. So starting with our questions, so doctor, could you please brief our audience what is trauma and what is emotional trauma specifically?
Good evening, namaste. Trauma is an extreme threatened event which can be physically harming, challenging, which involves severe injury, threat, death, assault, accident. There are different types of trauma. I would like to differentiate. There is traumatic brain injury, which is the physical form of injury to the brain. Today we are specifically talking on emotional trauma, psychological trauma. Psychological trauma, emotional trauma is the scenario where certain event has caused extreme kind of fear, intense threat, vulnerability and harmful situation in which an individual, whether a child or adult, doesn't know what is the coping method or what is the way out. For examples, scenario of natural disasters. If there is a flood, there is a fire breakout, in avalanche, some other natural disaster is an earthquake, people are displaced, there is a certain level of loss of life, property, harm, physical injury, homelessness, uprooted from the security and safety environment. One example of the natural disaster which we have recently seen in the hill regions are the flash floods. There have been different earthquakes, the Latur, in the Kutch, then there have been lot of cyclones. These can result into severe traumatic worry. Then there are man-made disasters. Common example, sexual assault, physical abuse, sudden information of a threatening disease condition, terminal illness, vehicular accident which can result into disability or loss, sudden violent death. Another common example is exposure to domestic violence, whether it is between the spouses or a parent or a adult figure. Lot of children are exposed to emotional trauma which results into lot of psychological illnesses and disability conditions.
Okay, so doctor, what can be emotional trauma situations and causes as such?
As I mentioned, very many causes. Sudden loss of life, as in a vehicular accident or some fire accident. One common example which many of us remember, even if it is distant geographical location, when the 9/11 bombing happened in USA. That is a very serious psychological trauma provoking scenario. When the first when the first plane hit the tower, nobody knew about it until the news start to relay. When the second tower and the Pentagon was hit, people watched it live on very many radio stations, which created a ripple effect of trauma, and those traumas are called complex trauma they continue to resonate. So very many people who are exposed to these kind of scenarios, they carry on the fear, and it can result into lot of debilitating scenarios. Children who have been exposed to parental violence, or if there is example of domestic violence between parents, so small children, when they are subjected to these kind of scenarios, they develop fear, they develop doubts, they develop a loss of identity and safety security, which can result into traumatic scenarios and lead to again restricted emotional growth or maladaptive scenarios.
So, doctor, what are the symptoms of emotional trauma? Is it the same for everyone?
uh, Answering the second question first, no, it is not same for everybody. It depends on the age factor, it depends on the exposure level of trauma. Trauma has different forms, like a 2-year-old child who's been subjected to parental violence or emotional neglect by the mother will have a different way of expressing rather than a teenager who has been humiliated in the class or subjected to any accidental situation. Same way, the physical symptoms, the emotional symptoms, the cognitive symptoms, and the social symptoms vary from age group to age group. But the general presentation are lot of people who have been studied in different research and clinical settings who have undergone emotional or psychological trauma do present with lot of physical illness condition, commonly gastritis. They usually have a upset tummy scenario quite often. Many of them eventually end up with IBS, irritable bowel syndrome. They have acid reflux. There are skin flare-ups, breakouts. They have a lowered immunity system, migraines, headaches, drug substance abuse dependence is quite commonly seen as in terms of physical scenarios. These people are also seen with high-end risk-taking behaviors. For example, driving at a very high speed, doing drugs, having promiscuous behavior. When I talk about another physical form of symptomatology, it has been seen in adults that some of the individuals who have gone sexual assault or rape or molestation in different age and stage in their time, they end up having overdrive for sexual behavior, or they may also have difficulty in having a good sexual life with their partner. There are inhibitions, or there is also disgust around a personal physical intimate behavior. When I talk in terms of cognitive symptoms, lowered attention level, wavering focus, lack of motivation, difficulty in memory systems, unable to complete a task, and they often complain mental fatigue because many of them are into the overthinking mode, which results into compromised attentional levels. When they talk about generalized fatigue, it is actually a presentation. Many of the other family members or social circle people of these individuals say, but you are healthy, you shouldn't be saying that you feel tired. But because the brain is always in the overthinking mode, and the thinking pattern results into finding escape routes, because there is a lot of sense of shame, guilt, helplessness, hopelessness. So these emotional factors also make them more vulnerable to social discrimination. They usually have lot of social anxiety, and the social relationships are also very many times compromised.
So, doctor, does trauma affect the quality of life, and is there a spillover?
Many times in lot of research and in clinical settings we have seen that there is surely a spillover because the quality of life is compromised. uh, when we talk about quality of life, if an individual is not satisfied with his or her social relationship, there is lack of trust, there is lack of commitment, there is lack of drive. Obviously the career, education, personal relationships or financial planning does get compromised. Many times uh, these individuals feel themselves as they are under the scanner. uh, they always have a sense of many a times that people are judging them or they need to be perfect, which results into continuous anxiety about doing things right, being absolutely okay at times, which again compromises in their ability to prioritize for themselves or have a systematic way of finding the work life balance. Many times lot of individuals who have undergone psychological trauma also develop a defense mechanism which we call it emotional insulation. Another form of defense mechanism is numbing. They do not express their emotions openly and comfortably. uh, for example, if they are happy, they kind of judge themselves ki if I'm too happy something may not be right, if I'm being too worried people will not understand, but it, or if I'm sad I shouldn't be expressing my sadness or anger because I will be judged at something odd one out. So and they develop an insulation system where they do not express their feelings comfortably. So in these scenarios many times the interpersonal relationships are compromised.
So, doctor, what is resilience?
Resilience, if I have to simplify, it's a ability to bounce back. And I give the common example of a bouncy ball. So the harder you thrust it on the floor or ground, the higher it bounces back. Resilience is one of the best tools to overcome stress and have a system of buffering ourselves from emotional trauma and shock. If I have to give further examples, resilience is one of the best abilities that human have, that we have been able to survive so many years of millions of years of evolution and come out to this stage. It is our capacity which helps us to be okay and find a way forward in spite of miseries or in spite of sad or uncomfortable situations. Like a simplified example, many of us have seen grief or bereavement around us in different life stages, but sometimes people are able to come out of it faster because they have an outlook towards resilience. There are factors which affect resilience, as our positive thinking, attitude, our social networks, and our ability to have a meaningful life for ourselves and others around us.
So, doctor, what are the methods for coping with trauma?
The first and foremost is that understanding that there is not a single organism in this world who has not been subjected to some or the other kind of trauma. Where there is life, there is challenges. For some individual it is at the extreme end of the spectrum, for some it is moderate. Our ability to look forward and find a meaning to the event or the tragedy helps us to look at it in a wider lens or a bigger canvas of life. The important part is having the ability to find a network, a group of people who trust us, whom we can trust, whom we can relate, who understand our pain, not in a just a victim mode, but as a observer of life situation. It is hard when people have personal tragedies or major losses, as an example of a death of a loved one without any time to say a goodbye, or loss of immense property or business. Um, People have been subjected to these scenarios on and off. The ability to have a understanding and see it in terms of a growth opportunity, see it as one phase of life and not the only event in life. We call it post traumatic growth. There have been lot of studies, there are live examples that people have come out of miseries in extreme, and that term we use is post traumatic growth. It is a result of our ability to develop a wider scan. It needs support, it needs professional guidance, and it takes time, but we do not need to live with trauma. In my clinical practice, I often see that people have been holding different kinds of emotional baggage and carrying on with the guilt, shame, disgust, or repulsiveness for years and years, which takes a toll on the physical health, which takes a toll on life quality. It is important that seek help, get proper system of reaching a professional, and learn to have a good outlook and come out of trauma. Remember, it is not that we need to live with trauma. I always and often use this example that I'm using it as an analogy, that this piece of coal had to go intense trauma, extreme trauma to become this diamond. And all of the human species has that ability to find that growth and meaning and live a better quality of life. Thank you.
So doctor, are there any long-term effects of trauma?
We have been seeing that, as I mentioned earlier, it results into physical ailment, right from cancers to cardiac conditions to uncontrolled diabetes, autoimmune disorders, and obviously the emotional connectedness. Because people feel insecure, their quality of life in personal and social areas does get compromised. So it is important, again, as I repeat, to come out, speak, get professional help. There are opportunities to be okay and become comfortable in yourself.
So coming towards our audience question, so doctor, in a couple, a sudden withdrawal of one partner from family without any reason and want to be lonely, is there any specific reason?
This is a very individual scenario. It doesn't really relate to a traumatic situation until I get the context of what may have caused the one partner to withdraw. But there may be, again, underlying individual reasons that one of the partner decided to withdraw from the family system. If there is no connectivity and no connectedness between the spouse, the remaining involved partner should still come out and seek therapy for himself and herself, or get an insight on how to find way to move forward.
So doctor, are there any early warning signs of possibly mental health problems?
One we commonly see, again I'll use it in terms of different age groups. I'm talking from say toddler age till 8-10 years, children. In a hypothetical scenario, if a child is sometimes molested or sexually abused, he or she may not be able to vocalize or express the anguish, because the perpetrator of the crime may have made the child feel fearful or threatened him or her with certain consequences. So sudden moodiness, bedwetting, regressing into a lower age group, uh, refusing to eat, refusing to engage in play activity with friends, refusing to go to school, clinging to a parent, or being very aggressive can be signs and symptoms. If it is a teenager, uh, it can be again risk taking behavior, acting rebellious, or somatic presentation. They may have upset stomach, they may have anger issues, they may show uh, poor academic performance, they may become very sleepy or avoiding sleep, they may report of nightmares, uh, horror dreams, or they may just show intense fear. In adults, it is manifested more differently. Sometimes people are able to vocalize, but if it is sometimes as sexual abuse is many times perpetrated in the home environment, people try to avoid certain family members, people try to avoid family functions, or they may just become very lonely, or they may become very, again, seeking outer support systems to survive. So these symptoms can be very different according to age, gender, culture, and social background of the individual.
So, doctor, can people get over mental illness without medication?
Yes, surely. It also depends on the level of mental illness. There are certain conditions and certain stages of mental illness, as in any other physical condition. If it is diagnosed and identified at an early stage and it is at a primary level, many times a good psychological therapy, psychoeducation, and a healthy family environment can be supportive enough. But if there is an extreme advanced stage of the condition, then like any other physical health scenario, medication and adequate pharmacological intervention may required. But nowadays a lot of people do have inhibitions, and there is a misconception about that many of the psychiatric medication is habit forming. I would like to emphasize, even as a psychologist, it is a big myth. As of for any cold, cough, fever, or chest infection, one would go to a general physician, internal medicine specialist, or a pulmonologist. It is good to come to a psychiatrist, psychologist, have an opinion, and then let the professionals decide that medication is required or not.
So, doctor, what are the ways to maintain a positive mental health?
Love yourself, not in a narcissistic way, but in a healthy, balanced way. Find avenues to give meaning to your life. Life is not about just education, job, family, and financial well being. It is about developing a human value system. Have a good balance between work, life. If you are a student, find time to engage in creative hobbies. Do not indulge in alcohol, tobacco, or psychoactive substances, because that is surely a gateway to a decreased quality of life and opening outlet to mental health issues. Be having certain compassion, be helping to certain people who are more needy to you. Have a pet, volunteer at some NGOs, and you will surely have a good quality of life.
So, doctor, how can we speak to and help someone with a mental health problem like depression or anxiety?
Have a non-judgmental and non-biased approach. Many times when we see people in dire situations, we start giving them lectures about do's and don'ts. But understand, if the person is already mentally fatigued or in a low mood, and somebody is trying to give him lot of sermons about do's and don'ts, he or she will feel more incapacitated. They are already in the low mode of understanding comprehension, or they have low self esteem, so they will feel more uncomfortable about these things. In family system, having a neutral conversation about seeking help is always welcome, but many times unconsciously many of us give extremes of example, which puts a pressure on the person who is going in through the depressive or anxiety state. I always recommend it is okay to reach out to a professional and let them do their job, because then the person who is suffering the scenario will be more open and will not feel judged, or may not be feel typecast as being good for nothing.
So, doctor, coming towards our last question. So, could you please tell our audience about the facilities provided at Apollo Hospital, Jubilee Hills, Hyderabad?
So we have a comprehensive uh, sector of and different departments, right from internal medicine to psychiatrist to psychological intervention. As a psychologist, I do assessment, behavioral intervention, and psychotherapy, psychoeducation. There is a good team of psychiatrists who provide very good pharmacological intervention and supportive system. Reach out, we are there to support, help, and improve your quality of life. Remember, this is the only life we know of, and it is totally in our hand and capacity to make it good for ourselves. Keep well, stay healthy, and enjoy.
So, dear viewers, we have come to the end of our session and hope we have covered all aspects. If you still have more doubts, you can book an appointment with Dr. Namita Singh and clarify your doubts. Thank you, doctor, for educating our audience in today's session.
Thank you. Namaste.
Thank you for joining us. Stay tuned for more such educative live sessions. Namaste.